So you just saw CliniScripts. So can you tell us a little bit about what do you think about it and how it will be able to help you in the work that you're doing?
It addresses all those problems. Like writing a note, I think, oh my God, the most difficult part is that you're basically asking the patient, and now you have to also basically write down your notes and you have to finalize it. I think it is an amazing, I think, program that you have, that voice, recorded, which is transformed into transcript. I think it's a big time saver, and accuracy wise, I think it can be a big helpful. So time, I think it is again giving you also putting you into a proper fashion, which you don't have to think about it, how you're going to, dictate your narrative or your assessment, by just thinking, because a lot of this program is already, taking whatever you are talking, I think coming back with a very well formatted, very organized write-up over there. So that saves a lot of my time. And then it is bringing the investigations of the patient over there. I think the same assessment, which I believe that we can look at that same complete assessment of the first visit, initial visit of the patient. The time can be reduced to, I think it will be very, very efficient. I think I'm really looking forward to use this one, particularly in the chronic insomnia evaluation, and I think it will be very helpful.
Okay, so a final question. I promise you, there's tons and tons of AI Scribe companies out there. We are in a very competitive space. So so the question is very simple, because you've been on both sides. You've been on mental health, you've been trying to do sleep clinic, and you have been also an internal medicine physician as well in your last 35 years of practice. My question to you is, an AI Scribe company which is 100% focused on mental health, how is mental health different from other specialties? And how, you already talked about, it's going to help.
Yes, I think that first of all, the community at large, our medical community and professional in mental health, the sleep and mental health are intertwined. I think it is a disservice to the very mental health discipline that if you basically take sleep as a standalone entity. No, sleep is not a organ-based specialty, just like a heart. I have a chest pain, congestive heart failure. Sleep is a very encompassing specialty which affects every aspect of our human physiology and health and disease. So mental health program has to be intertwined, has to be interlinked with the sleep. So that is, I think, which I hope that with the program, we basically will bring the sleep right to the forefront and all that. Without addressing the problem of sleep, you cannot basically address the mental health problem, I think, in the term of the quality, in the term of the care and all that. Very simple example. There will not be a PTSD patient discussion, management, evaluation, all that, without having the sleep to play the central role. Because sleep is right at the center, right and left of the PTSD, bipolar disease, depression, and anxiety. So this is how I see that, by merging, I think they do, and this forum will allow us to merge these two specialties in a very integrated fashion when we are doing the evaluation of the patient and subsequent treatment plan. A lack of improvement in the sleep is a poor prognosis in patient with depression. Persistent sleep problem basically means that we are not doing something right. So it is a indicator of inadequacy of the treatment, and there are so complex issues which interact with each other. Bipolar is an example. The initial the two phases of bipolar, particularly the mania, it doesn't come out of the blue that you're sitting and you're having a mania episode. The initial subtle changes in the sleep is essentially the sign that upcoming episode of mania. So this is how it is important. The moment you start getting the sleep disturbances early on, can warn the attending physician that you are going to enter into the mania phase, and before you end up having a full-blown mania and hospital admission, you can start basically working on the sleep, aggressively ahead of you end up degenerating into complete mania. This is how important it is.
So again, the question is, so you talked about sleep and mental health. Now, my question is also, how do you so we definitely understand, and we believe that's the reason that we are focusing on mental health and sleep together. But as compared to internal medicine, as compared to an oncologist, as compared to cardiologists, how do you think that this field can use something like CliniScripts, something like an AI Scribe, but more as compared to some of the other specialties?
Well, I mean, you can. The other way of asking these questions that is the overall mental health should be part of the complete internal medicine evaluation. The answer is yes. The evaluation of the cardiovascular health basically should include something about the sleep? The answer is yes, because as I said, that sleep is basically an encompassing, I think, specialty. It is a symptom and sign of almost, and it affects almost every other disorder. And as such, I think at least including some mental health and sleep as a part of all the specialties, I think it will go a long way in improving the overall care in those subspecialties.